Hello, hello, hello. Welcome, welcome, welcome. Come in, come in, come in. This is Tamika's Den. I am Tamika. Get on in here, y'all. Get on in here, okay? Kick off your shoes and relax your feet. Let's breathe in that confidence and exhale that doubt, okay? Today is about self-care, okay? It is about positive affirmations. It is about, bringing awareness, spreading awareness, stopping stigmas, ending these myths, teaching ourselves some new things, getting into positive modes. That's what we trying to do up and around and all through here, okay? Now today, guys, you know how it go. I had my mind focused on one thing. Of course, as I mentioned to you last week, I really wanted to address some things with chronic illness, chronic pain, how it affects us, and the fact that there are many causes and reasons why we lack with our own self-care, you guys, and we put ourselves off when actually that is supposed to be the most important thing that we do and we take care of. And so I'm still going to address some of these issues. I guess you could say this is kind of like a part two, and this may just end up being a series of a couple different things throughout this month, because first and foremost, before we even get into anything else, this is, Breast Cancer Awareness Month. This is also Domestic Violence Awareness Month. So, of course, for breast cancer, we go pink, okay? That's why I threw on the pink sweater, because I was wearing blue today, but I got to represent and show some love for my survivors, my warriors, my people that have been through it. We know that cancer affects so many people on a daily basis, way more than it should, okay? And it also is Domestic Violence Awareness Month, which we wear purple for, okay? We go purple with that. And so we are going to bring a little bit of awareness with breast cancer awareness and domestic violence awareness as well. I'm here supporting the fighters, admiring the survivors, honoring the taken, and never ever giving up hope, right? That is first and foremost before anything else goes down. I had to say something about that. And so, having said that, like I said, I wanted to just talk about different things and reasons why we neglect our self-care, right? And using breast cancer and domestic violence, for examples. Of course, a person that is dealing with cancer, they may have to have their breasts removed. They may have to have surgeries. They have to go through chemo. All of that within itself is a lot, right? Definitely will have you stressed, going back and forth to the doctor, doing different tests and all of that stuff. It could turn into where that starts to feel like a job. That's draining you, right? It's hard enough just to do that, let alone to think about self-care. Think about somebody that's dealing with domestic violence. Mentally and physically, they are drained, right? And going through all different kind of changes and obstacles. So self-care is definitely not going to be at the top of their list. And we have way too many people that are in, domestic violence relationships and situations going on, right? We know that these are two very big issues, and we can do separate videos on each one of these things, right? And then when we think about abuse comes in many different ways, right? It's not just physical, but of course that's one of the ways that we know. We also have emotional, we have financial, we have verbal, okay? And so not all scars can be seen. A lot of times when we see somebody, if they're in a wheelchair, if they're bedbound, if they have certain, scars we can see, then we're kind of more attentive to them. And it's like, oh yeah, they sick, they going through it, right? But it does not look the same way for everybody. Some of our scars is on the inside where nobody can see them. And we can't just, judge or assume that other people are not hurting, right? Just like I said with many of different topics that I've talked about up here, including sickle cell last week, how it looks for one person is not how it looks for another. And so just chronic disease in general, right, is basically when a person has a condition that lasts them a year or more, right? And it's an ongoing medical condition that most times limits their activities, right? And daily living, or it could be both. It could be one or the other, or it could be all of the above, right? And a lot of the chronic illnesses we have and diseases we have now, there's many more. This is just a few, and these are usually the top ones that each of us know somebody that has had at least one of these things, right? It's going to be heart disease, cancer, diabetes. Those are the leading causes of death and disability in the United States, guys, okay? arthritis, high blood pressure, kidney disease, Alzheimer's disease, dementia, COPD, autoimmune diseases, and depression, you guys. Believe it or not, a lot of people don't know. Some might know. Depression is actually number 2 after heart disease. Depression can be a silent killer, y'all, okay? Especially when you have severe depression. Of course, mental health comes in different forms, just like physical health do. I keep, trying to remind you guys and put that out there. And physical can cause mental, mental can cause physical. So even when we think it's no big deal that we're not giving ourselves self-care, it actually is. The more you're neglecting yourself and not giving yourself self-care and not taking care of yourself in the right way, is the more chances for you to have physical issues as well as mental issues, guys, right? So we want to prevent those things from even starting. And if we're already in a situation where we are dealing with some of those things, then we want to take care of ourselves to the best of our ability so that we don't get more things, or the things we have going on right now do not get worse, right? And so, of course, if you're dealing with some of the specific symptoms that you will have, child, I'm getting tongue-tied, y'all, but work with me, is pain, fatigue, and mood disorders, right? That's some of the top ones that you'll have, right? Could be more. And when we looking at the treatment that we have to go through if we're dealing with any of these things, sometimes that in itself, again, can feel very strenuous, can make you feel like, that's a daggone job within itself, just trying to maintain yourself, to take care of the illnesses that you have, right? Or to go with a person that is sick that you're helping to take care of. I've talked about that as well, right? Is an impact on you too. If you're going to nonstop doctor's appointments, like I said, you could be seeing neurologists, orthopedics, oncologists, physical therapists, occupational therapists, psychologists, psychiatrists, social workers, case managers, vocational counselors. That's a lot. That's a lot. So by the time you get home, you don't feel like doing nothing else. Okay? You got to remember to take your medicine. You might be doing surgeries, like I said. You might be getting hot and cold treatments. You might be getting therapy or exercise to reduce inflammation, muscle weakening, spinal problems, electrical stimulations, injections, acupuncture, child. And guess what? I done had majority of the things that I just named. Okay, so I know I'm speaking from experience as well as taking care of people. Okay, I'm not just talking about this to be talking about this. That can feel like a job, and that can wear you out too. You don't even want to do that. Sometimes you may forget your medicine, or sometimes you just may not be in the mood for it. You may forget a doctor's appointment, or you just may not be in the mood for it. You don't want nobody picking and prodding on you. At the same time, you're so miserable from being in pain that you're like, let me try this or let me try that, because you want the pain to stop. And some things is gonna work and some things is not, y'all, and you really don't know until you try it. Like for me personally, the first injection I ever did helped me. The next two gave me boils and made me feel even in more pain. Acupuncture didn't work for me, but I know people that love it, okay? So unfortunately, we don't know, and we can't, see ahead of time whether it's going to work for us or not. We got to just kind of try it, and then it's like, hey, that worked, or hey, this didn't work, right? But we got to also do our own research and look up things and look into things. And if one doctor, because I know we don't like going to doctors, okay, for many of reasons, okay, but listen, you can go to as many as you want to until you find that one that is right for you, because it is important that we do the things we need to do for ourselves, whether physically or mentally. I'm always going to advocate for that no matter what, right? And if one thing doesn't work, try something else, because that one might, right? Don't give up. And, when it comes to mental health, we got to have, stress management and relaxation training, meditation. I talk about that all the time, right? Behavioral changes training. Honey, all of us, okay, whether you have some issues that you've been diagnosed with or you have physical ailments or not, I believe should be having behavior changes training, And also it's very important to have patient and family education and counseling, right? Because if this is something new that you're not familiar with and you don't know, how you're going to feel, what you're going to feel, what the treatments are, it's good for you to be educated on, and also your family to be educated on it, your friends to be educated on it, because they will be the ones that will be around you the most and that you might have to depend on for some help. I know one thing that I always bring up is how much I appreciate it that when I told my girlfriend I was diagnosed with fibromyalgia, she went and looked it up on her own. She wanted to know what the heck this was because she had never heard of it before. And that meant a lot to me. And then when she read up on it, she was like, my God, girl, all those different things, no wonder you feeling crazy. So, speaking of that, of course, chronic pain comes in, many different ways. And like I mentioned, mental can also be chronic, you guys, okay? Not just physical. And of course, there's all different types again. And so some of the chronic disorders that people can have is schizophrenia, severe depression, severe bipolar, anxiety disorders, post-traumatic stress, things of that nature, right? And then with chronic pain, you would basically more than likely, okay, it can start with an illness or injury. And the top causes of chronic pain would be like low back pain, headaches, right? Migraines, multiple sclerosis, nerve damage, neuropathy, osteoporosis, fibromyalgia, shingles. Listen, I got like 5 out of those things that I just named. So just imagine it's hard enough when you're dealing with one or the other, let alone when you have several different things and you trying to deal with all of them. So, of course, it is common sense that if you are dealing with those things, you are not going to be thinking about self-care. That's going to be the last thing on your daggone mind. You're probably going to be irritable. Your sleep patterns is going to be messed up. Either you're going to sleep a lot or you're not going to sleep enough, or it's going to be too much sleeping. Your mind is going to be racing. You're going to probably have disturbing thoughts at times. You're going to have a high level of stress and anxiety. You're going to go through different types of feelings about having a condition or about your loved one having a condition. You're going to feel lonely and isolated. You might have social withdrawal, lack of motivation, difficulty focusing and concentrating. Okay, you get the picture. It's a lot. It ain't easy. And so, of course, those are some of the more severe reasons why we would lack self-care, right? But then there's other things, along with having physical injuries or a brain injury or mental illness and any of those kind of things, right? That's going to basically affect, your physical abilities, your energy levels, your attention, your organizational skills, your motivation. This all tie in together, guys, right? Besides that, you also have, just in general, right? We feel guilty. We feel guilty about self-care, right? We have the lack of time. We say it's not too much hours in a day for us to get everything done, right? We have unrealistic expectations. We have difficulty creating new habits, doing new things. That scares a lot of us, right? And you may see self-care as luxurious, right? You pampering yourself, or it's supposed to be something that's so expensive. Wrong, okay? Wrong. You have basically been defining self-care wrong this whole time, right? And you've been thinking that putting yourself means putting other people last. Oh, I got my kids, I got my husband, I got the job, I got school, I got grandma. You got all these different people that are depending on you. But guess what? If you're not taking care of you, you're not good to them anyway. You're going to end up crashing and burning. So instead of letting that happen, please take care of yourself, guys. You think you can't afford it. You think self-care is supposed to be something expensive. No, it's not. It's not. Okay, I give you guys self-care tips and self-care ideas up here all the time. Okay, go back and look at some of them old ones. Check them out if you need a reminder of, just how simple and inexpensive self-care can be. Okay, we got a range of different things, and self-care is not one thing, and it doesn't have to look one way. We confuse self-care with comfort. And at the end of the day, you guys, you deserve self-care, point blank, period. Like, there's no other things that need to be put into that sentence. That's the end of the sentence right there. You deserve self-care. Okay? And self-care should be a daily priority. Daily. But if you can't do daily, every other day, every couple days, every week at a minimum, this should be something that we should be making a regular routine for ourselves, guys. Make it normal, okay? Make it normal for self-care to be your number one priority for you. Because if you are not okay, you cannot take care of anybody else. I'm going to keep telling y'all that, all right? And it's not an emergency procedure at all. Take care of yourself today. That's my message to you guys, okay? That is my message to you guys. And I'm going to end this off with, you know, you got this. You got this. Whatever it is, you got it. And even if you don't got it this minute, this hour, this day, guess what? You can try it all again tomorrow. You can try it all again later. Don't give up. Eventually, practice makes perfect. If you keep doing it, no matter what it is, and you really want it, and that's what you want to do, and you claim it, and it's meant for you, was meant for you, nobody could take away from you. You got this. All right, guys. I hope you guys have a great day. Okay, if today is not a great day, I hope tomorrow is a better one. Remember to spread awareness and remember to take care of yourselves, okay? Relax, relate, release. Kick up your feet. Enjoy the rest of this weekend. Till next time, make sure y'all like, comment, share, subscribe if you are so inclined, okay? Give me a wave. Let me know you came by. See ya. Toodaloo.